eligible. The with Prescription Advantage, of course, being a state-sponsored program, our members must be Massachusetts residents. But we do have benefits for people who are age 65 and older, who are eligible for Medicare, 65 and older and not eligible for Medicare, and also people who are under age 65 who have a disability. And before I get into the details of, the eligibility, like the different requirements and benefits, I do want to mention who is not eligible for Prescription Advantage. And this would be individuals who have Mass Health or Common Health or have a Mass Health buy-in program. And these programs are also referred to as Medicare savings programs. But the reason why we exclude people that already have coverage under these programs is they're already getting subsidized prescription drug coverage. Prescription Advantage really can't do anything any better for them. So basically, they don't need us.
Excuse me, Kathy.
Yes.
I'm sorry to interrupt. I only see the front page of this
Oh, really?
presentation. Are you advancing the slides?
I am, yeah.
So what I would do is stop share. Yeah.
I'm going to stop sharing and let me start it again. Thanks for mentioning. When you're on this end of it, you never know what everybody else is saying.
Exactly. Click on the one on the top left and it should show us what you see.
Okay.
Perfect. Thank you.
Are you seeing that now? Okay. I'll try advancing them a different way. So this is the slide that says screening for other cost savings programs. Everybody see that?
Yes, thank you.
Okay, great. All right. So part of our application process when people apply for Prescription Advantage benefits, we do look at information to see whether or not they may also qualify for other programs. People often don't realize that there are other things out there, such as a program called Extra Help, which helps people, again, it lowers their prescription drug costs, and those Medicare savings programs, which can also lower their costs. So it's in our regulations that if it appears that somebody may qualify for one of these programs, we do require that they apply for it. And we will actually assist them with that application process if they need us to. But, all right, let's see. Okay, all right. Did it change slides? Does it say individuals age 65 and over?
Okay, yes, thank you.
Where we want to be. Thank you. All right, so one of the first things I mentioned was that we have benefits for people over 65 who are not eligible for Medicare. We have benefits for people who are under age 65, and actually, I think there might have been a slide before this one, but now I'm afraid to go back. Okay, this is the one. Do you see individuals under age 65?
Yes.
Yeah.
Okay,
Yes.
that's where I wanted to be to start with this one. All right. So when I think of Prescription Advantage, I often think of it as almost like it's almost like three different programs under one umbrella, because we have these three categories of people that we have benefits for, but with each category of people, the benefits are different, and the eligibility requirements are different. So if we have, first of all, people who are under age 65, okay, some of the crazy rules is that they cannot work more than 40 hours per month. Income cannot exceed 188% of the federal poverty level. So you can see what that is in terms of what gross annual income. If somebody is single, that just means income cannot exceed $25,549. if they're married, cannot exceed $34,423. But I do want to mention, even though, we tend to always show income as either single or married. But, when somebody's under age 65, or it could be any age, it's not unusual for people to maybe have children still living at home, or in some cases it could be great, they are raising grandchildren. So there is a question in our application that does ask how many, if you have any relatives who are living with you and depend on you for your support, how many other than your spouse. So if somebody had 2 children at home with a spouse, then that would make them a household of 4. So 188% of the federal poverty level for a household of 4 is actually higher. So we tell people, don't just look at, these numbers, call Prescription Advantage, even though your income might be higher, you may still qualify. There is information in our application in terms of what documentation we need for somebody who is under age 65. And this would be to show proof of a disability. There is no charge for this program. Okay, this is free. We also don't look at assets. So we don't look at how much money somebody has in the bank. That would be an asset. We don't care if somebody owns their home. Okay, we're only looking at gross annual income in order to determine eligibility. And also just an added benefit for Prescription Advantage is that with each, with our members, we also put a limit on what people will spend out of their pocket. So they have a cap on what they will pay in copays. Now, when somebody is under age 65 and they don't yet qualify for Medicare, Prescription Advantage would be able to provide them with primary prescription drug coverage. And I'm going to show you a chart in a couple of minutes so you can see what that looks like. But once the person becomes eligible for Medicare, then Medicare would become their primary insurance and Prescription Advantage would be secondary. So when you think of somebody who's under age 65 with a disability, now they might, let's say they're 60 years old and they're disabled. Once they've been disabled for 24 months, okay, then they become eligible for Medicare. So, and that's all determined by Social Security. So even though we think of age 65 as being the age that people become eligible for Medicare, it's different when somebody has a disability. Somebody could be under age 65 and be on Medicare. The next group of people that we provide benefits for would be individuals who are age 65 and over and not eligible for Medicare. And I often get the question, it's like, I thought once you turn 65, everybody gets Medicare. But that's not necessarily the case because eligibility for Medicare is determined by how long somebody has contributed to through Social Security. And you've probably heard the term 40 quarters. Okay, well, they need to have been contributing for 40 quarters, which really what that means is 10 years. But once somebody has contributed for 10 years, then they become eligible for Medicare. So we have people, right now we see people who are under age 65, and it could be that they moved to this country later in life. Maybe they were 60 and they came to the United States. They might be working, maybe they are, maybe they're not, but they haven't become part of the Social Security system, in which case they're not going to be eligible for Medicare yet. This is where Prescription Advantage could help. We would be able to offer primary prescription drug coverage. And in this case, there is no income or asset limit. There's no monthly premium or enrollment fee, okay? Again, the coverage is free. And co-payments, deductibles, that's going to be determined based on the person's income. So I'm just going to show you what that looks like on this chart. So if we have people who are not eligible for Medicare, if the person is under age 65, you notice we have the first column on the left says membership category. And then next to that, we have ranges of income. And this is how we determine, what a person's benefits are going to be. And it depends on their income. We slot them into a member category, and then their copays would be based on the category that they're in. So if we have somebody who is under age 65 with a disability, okay, their income, based on their income, remember we said it was 188% of the federal poverty level, okay? They would not exceed a category 2. That's where the cutoff is. But for individuals who are age 65 and over and not eligible for Medicare, okay, that was the slide we just looked at, and we said there is no income limit, okay? So if you look at member category 6, you notice it's open-ended. So somebody can be age 65 or over. It doesn't matter what their income is, as long as they're still not eligible for Medicare. We're going to just put them in the appropriate category. And you notice we have an individual quarterly deductible, which we don't have for categories 1 and 2. Okay, there is no deductible. But once we get to category 3, there is a quarterly deductible, which means in this category 3, somebody will pay the first $65 in January, and then we start paying. Then again in April, the member will pay the first $65 for their prescriptions. Then we start paying. So, and then the deductible goes up depending, as income goes up, the deductible goes up. And then the copays, for retail copays, you notice there's 3 levels. And a level 1 is for generic drugs. A level 2 is for brand name. And a level 3 is for, we use it for expensive drugs, but we also use it for what we refer to as a non-preferred drug. And a non-preferred drug is a brand name drug that has a generic equivalent. So if you think of something like Lipitor, Lipitor is a brand name. Years ago, generic equivalents of Lipitor came out. And if somebody were to take the generic equivalent of Lipitor, they would pay the $7 copay, okay, the 7 or the 12. But if they still take Lipitor, they're going to pay the level 3 copay. And then we have mail order. For people who use mail order and get 90-day supplies, for many of their maintenance drugs, which we really encourage people to use this, because if you look at the copays for a 90-day supply, it's really like getting a month free. So now we have individuals who are eligible for Medicare. And to be honest, this is really the bulk of our membership. Our program, we really do more work or provide more benefits for people who do have Medicare, and this is where we are a secondary payer. But because we are a secondary payer, that means that the person needs to have a primary payer in place. And that primary payer can be either a Medicare Part D plan, okay, the Medicare prescription drug plan, or a Medicare Advantage plan. Those are those HMO type plans, but the Medicare Advantage plans have the prescription drug coverage built into it. Or somebody may have creditable coverage. And creditable coverage is prescription drug coverage that is usually through a former employer or union. This might have been something that was a retirement benefit, in which case they have something. They didn't necessarily need to get a Part D plan, even though they qualified for Medicare, but because they have this other coverage, that will act as their primary. Here we have a new income limit for people who are eligible for Medicare. Okay, now the income limit does go up to 500% of the federal poverty level, which for a single person, that would be $67,950. For a married couple, $91,550. And this is so unusual. I don't know if many of you get involved in many state or federal programs, but to have something with income limits this high is very, very unusual. And the fact that there is no asset test. And I'll show you on my next chart, but for people with an income that is at 300% of the federal poverty level or less, this program is free. It's when they're in that 300 to 500%, there is a charge for it. Okay. So with this first chart, for folks who, again, we have our member categories, and if somebody were to be in the category of S0 or S1, these are members who not only have Medicare, but they also have an additional benefit called Extra Help. And that's one of the programs that we screen for, because when people have Extra Help, when they qualify, this Extra Help benefit is going to help to lower their copays even further. And so they can still have prescription advantage. It's just when somebody has Extra Help, prescription advantage actually ends up becoming the third payer. Their Medicare pays first, Extra Help pays second, and then prescription advantage is then able to provide assistance. But it's a huge benefit. And when people have Extra Help, the benefits begin immediately. So even if they had a Medicare prescription drug plan that had a deductible, and it's not unusual, a lot of the plans have, gosh, I think they're up to about $450 deductibles, annual deductible. But if somebody has Extra Help is going to provide coverage even when they have the deductible. So they don't have to pay that first $400 or $450. Then you notice we have three categories, the next three, that the S2, S3, and S4. Okay, they all have their own income ranges. And as far as when benefits begin, and it says benefits will begin when the member's total retail drug costs reach $4,430. I know sometimes it seems like such a random number, but that's a very important number, that $4,430. Because for those of you who might be familiar with the Medicare prescription drug coverage that when individuals drug costs reach $4,430, that's the point that they have reached the donut hole. And I don't know if you've heard of the donut hole, if you're familiar with it. I'm going to talk about that in a moment in terms of what happens. But this is a point when people would be very happy to have prescription drug coverage if they are happy to have prescription advantage coverage if they reach the donut hole. And then our highest category, this S5, it's the only time somebody does pay for prescription advantage. Okay, these are the people whose income is now at that 300 to 500% of the federal poverty level. Okay. They do pay a $200 annual enrollment fee. So they pay the $200, and then once the member has spent $3,865 out of their pocket in copays, okay, then from that point, they will pay nothing for the remainder of the year. Prescription Advantage will pay all of their copays. And I know that it sounds like, well, it is a lot. It doesn't just sound like it. But when somebody, if they spent $3,865 in copays, that's usually somebody with very, very expensive prescription drugs. And we have a few members right now who are in this membership category that we started paying their copays in February. So somewhere between January and February, they spent that $3,800 out of pocket. And now Prescription Advantage is going to cover all of their copays for the remainder of the year. So $200 well spent. So this donut hole, just to kind of give you a little donut hole 101, Medicare will refer to this as the coverage gap. Somehow donut hole it's almost like a nickname, I guess. And starting in January, every January 1st begins a new Medicare plan year. So Medicare runs on a calendar year basis. And starting January 1st, any prescription that a Medicare beneficiary is getting filled, okay, when they are getting their prescription filled at the pharmacy is billing their prescription, their Medicare Part D plan. The plan is telling the pharmacy what to charge the individual for their copay. So in this example, you notice I said before the coverage gap, if somebody say if they had an inhaler and the total retail cost of that inhaler was $400, okay, well, the person's copay might be $50 for the inhaler. So they're paying $50. Their insurance is paying the other $350, but you add them two together and that's the total cost of the drug. So it's that $400 that Medicare or the plan is keeping track of. So every month when they get this inhaler refilled, 400 now becomes 800, then it becomes 1,200. And you add in any other prescriptions that they may be getting filled at the same time. And for some individuals, it doesn't take long for them to reach that $4,430. And I think I was very conservative saying this inhaler is $400 because we've certainly seen them for a lot higher than that. But what happens is once somebody reaches that coverage gap, now the person is responsible for 25% of the cost of the drug. So it doesn't matter what their Part D plan copays are anymore. It's like you pay 25%. So in this example, what they were paying $50 for prior to the coverage gap, they're now paying $100 for. And that's going to be, again, with every prescription that they have, they're now responsible for 25% of the cost, total cost of the prescription. So this is where Prescription Advantage can help. So remember those categories that we talked about, the S2, S3, S4, where we said benefits begin when your total drug costs reach that amount. So the key to Prescription Advantage is that our members have to let their pharmacy know that they have Prescription Advantage. We issue an ID card. Our members just need to present that to the pharmacy. There's information on the card that the pharmacy needs to be able to do all of the billing. And with the pharmacy systems, they just enter it in once. And then once they have it in there, they know bill the primary first and then bill Prescription Advantage afterwards. Bill us as secondary. So all of this billing takes place at the pharmacy. Okay, our members don't have claim forms to fill. They just need to make sure the pharmacy has the information so that they are able to bill us automatically. So what would happen is when that person is standing at the pharmacy and getting that inhaler filled, and all of a sudden they reach the coverage gap, and now they have their copay is now $100. That $100 is going to be billed to Prescription Advantage automatically. And we know from the information that the pharmacy provides us when they're billing us, we know that the person is in the coverage gap. All we need to do is look to see what membership category are they in and what is their copay going to be. So if somebody's in, assuming the inhaler is a brand name drug, and if this person is in that S2 category, we will tell the pharmacy to charge the customer $18. So they just went from $100 down to $18. If they're in the S3 or S4 category, we would tell them to charge the customer $30. So keeping in mind the fact that our members who are in these membership categories, they're not paying for Prescription Advantage, it's free. And we are able to lower their costs at a time when their costs are really going to go up. So it's a huge money saver. And just a couple of other benefits with Prescription Advantage is, first, people can enroll at any time. Okay, we're open year round for enrollment. Not like Medicare, where Medicare has their little window of time, their open enrollment period. People can join Prescription Advantage at any time during the year. And also, another added benefit is Prescription Advantage members, just because they are a member, they get what Medicare refers to as a special enrollment period. And this special enrollment period allows members to either join a Medicare prescription drug plan or change their plan. And it doesn't matter if it's a Part D plan or a Medicare Advantage plan. They have one opportunity every year, okay, one additional time a year that they can make a change outside of Medicare's open enrollment. So usually when you have, with Medicare, they're very tight. They have their annual open enrollment period every year. It's always at the same time. It's between October 15th and December 7th. And that's when people are encouraged to look at what they have this year to make sure that it's going to work for them the following year. And most people don't do that. And it's not until the following year that they realize that their copays went up, their plan's formulary changed, They might have had some prescriptions that were covered last year, but now they're not covered this year. And, if you don't do the research during open enrollment, you could be stuck in a plan that's not working for you. But as a Prescription Advantage member, they don't have to stay in a plan that's not working for them. They can make a change. So I don't know if many of you are familiar with the SHINE program, but SHINE counselors who are available throughout the state. They're usually located at, you can usually find one at the local senior centers, and this is a free service where a SHINE counselor will work with people to either get them onto Prescription Advantage. They'll help them research what other Medicare prescription drug plans are out there. So they will help them with this to be able to get them into a plan that will work for them. Now, as far as applying for Prescription Advantage, we have 3 different ways to do it. We have a paper application, and you can call Prescription Advantage. We have a toll-free number, 1-800-243-4636. Okay, call Prescription Advantage. They'll be happy to send you one. They will also offer to do it over the phone, okay, which is another option, to do a telephone application. And I always think this is sort of my preferred way of doing it, because when you're doing it over the phone, you're talking, you're having a one-on-one conversation with the customer service rep. And this is your opportunity to ask them any questions that you might have about the program. So they're more than happy to do them over the phone. And also through our website, we also have an online application. And that website, www.prescriptionadvantagema.org. We have the online application, but also all of our application forms are accessible through the website as well. So, but Prescription Advantage customer service, they're available Monday through Friday from 9 to 5. And then a couple of helpful resources which SHINE I just mentioned. But again, they provide free health insurance information and counseling to Massachusetts residents who have Medicare and also their caregivers. So any problems, questions people are having with their Medicare, SHINE can help them with that. And then also, there's another program that I don't know if you're familiar with, the MCPHS University Pharmacy Outreach Program, which that's a mouthful, but MCPHS is the Massachusetts College of Pharmacy and Health Sciences. They offer a great service where, and again, and this is free, no charge for this, where you can call the Pharmacy Outreach Program if you have any questions about your medications, because you'll be talking with either a pharmacist or a pharmacy student or a case manager. Questions about your medications, they could help to make sure that if you're taking them correctly. But also another thing they do is really look to see how people can save money on their prescriptions. Now, they know of a lot of different programs, which of course they would mention Prescription Advantage is one of them, but there are many other programs. Sometimes they're through the pharmaceutical company. People may qualify for their pharmacy assistance program. It could be a financial assistance program that is directly related to a particular condition or a particular disease, maybe something for people with diabetes, that there might be some insulin program that they're aware of, but always a good resource to tap into in terms of looking to see how money can be saved on the prescriptions. Okay. And then this last slide is my contact information, and I welcome you to, contact me anytime. My phone number is there. To be honest, the easiest way to reach me though is by email, because like so many people will all, some days in the office, some days at home. So email tends to work best. So at this point, I am going to stop sharing and to ask you if you have any questions for me.
Kathy, this is Mike Harrington.
Yeah, Mike.
That was a great presentation. It was
Oh,
so
thank you.
informative. I'm an insurance broker, and I don't focus on Medicare, but I do have about 100 Medicare clients.
Good.
So I do have a couple of questions for you. Is the 500% FPL level, is that new, and is it adjusted annually?
It's adjusted annually.
Okay.
Yeah, as long as the government, I've been with Prescription Advantage for so long now, and I think there was only 1 year that I remember that the federal poverty levels did not go up.
Yeah,
but it's every year. It's in April 1st.
Okay, and then how does the Prescription Advantage program verify income?
We ask for, there's a question in the application that we ask if the person still files federal income taxes, and if they do, we're going to ask for the most recent copy of the federal income tax form. If they say no, if they don't file federal income taxes, then we would just ask for a copy of any 1099, because usually, somebody may just have Social Security. So we'd say, just give us a copy of your 1099 from Social Security.
And then a couple other ones on the program for the folks that are 65 plus and eligible for Medicare.
Yeah.
On the slide, it said once the member spends $38.65 in copays, then that's when the plan kicks in, and that's per member, right? So a husband would have to pay. Okay.
Yeah.
And then the last question is, do you know how many members are in the program for 65 plus eligible for Medicare? I'm just curious.
Right now, it's about 28,000, which is very low. We have room. Yeah. When you think of how many people are 65 plus in Massachusetts.
Yeah, it's funny because I have a lot of clients that fall in, I think they're falling just short of that threshold.
Yeah.
You know what I mean? Unfortunately, but okay. Well, thank you very much for the info. That was great.
Yeah. Thanks, Mike. And thanks for the questions, because, as you see people, even if if you yourself, you're not dealing with Medicare that much, the minute somebody says to you, oh, my prescription drug costs are so high, isn't there something I can do about that? You could say, yes.
For sure. No, I agree. Thank you.
Okay, thanks. Okay, anybody else?
Kathy, that was an excellent presentation.
Well, thank you. You know what? And I always think that when you hear about information like this, I think it's important to just keep in mind, like, who do I know? Do I have, elderly parents or other relatives or neighbors, or, there's always someone. And to be honest, what I would just do is, if somebody said that they're having difficulty, struggling with copays and everything, refer them to Shine. The Shine program, they will screen them for every possible program that someone might qualify for. Somebody could see a Shine counselor because one prescription was costing them too much, and leave there realizing that they can save thousands of dollars because of other things they qualify for.
Shine presented here before, and they were excellent, It's
definitely
out there.
Yeah, keep them on your rotation. Because,
I must, yes.
Because, your audience probably is always changing. So definitely They provide such great service, but and Prescription Advantage, of course, is a program that they talk with people about.
Yeah. Does anyone else have questions?
I don't have any questions, but I just would like to say it was very clear to me as well, even if I don't know kind of the system from the beginning, but it was really easy to follow your presentation. And I think
Oh, well,
it's really
thank you. I
good.
appreciate you saying that.
It's really good to know those things as well, as you're saying, like to be able to inform people around you if you come across.
Medicare is complicated. And
That I've understood.
yeah, no doubt, Medicare is complicated. And then I think what's nice to know is that there are resources, that are out there in the community that are there to be able to help people. We have with the Shine counselors, which the majority of them are volunteers, but there's almost 700 of them in the state. So you can find them pretty easily. So, okay. Anybody else? Well, again, thanks for having me, and keep me in your rotation too.
I certainly will, Kathy. Thank you so much.
All right.
If anyone wants this PowerPoint presentation shared, if it's okay with you, Kathy, just send me an email, because I'm not come to, I can't see all your emails or anything, so you'd have to send me an email. And
Sure,
I put it in the
means.
chat box. Yeah, or directly to Kathy as well, of course, if you want to do that. I will be putting it up on my website, the recording of it. I'm still working on it. It takes me time to figure these things out.
Very good.
Yeah, but so upcoming Lunch and Learns is going to be this hospice coming. Leahy Clinic Hospice is going to be coming to do a presentation, and I will probably do a retirement presentation myself in the months ahead. And there's a few other ones I'm still working on. So I will keep letting you guys know and putting it out there. So you can always get in touch with me if you have questions. So if there's nothing else, we can finish it up.
Okay.
Thanks, Carmel. Thanks, Kathy.
Thank you. Thank you. All right.
Yeah,
I'm
it
going to
was great.
scoot. All righty. Thanks.
Bye, guys.
Bye-bye.
Have a good day. Bye.